So let's start with one diagnostic tool we should know: barium swallow. Barium swallow. And for your board exam, what should you know about barium swallow? For medical school, what should you know about barium swallow and hiatus hernia? Is the most sensitive test for paraesophageal hernias. Okay, so you will see the anatomy clearly, and in type 2 or type 3, the fundus will appear herniated into the thorax. So that is why barium swallow helps. What about endoscopy? Endoscopy is another test which can be done. Endoscopy helps to confirm the location of the esophagogastric junction, and it also helps us to rule out erosions, complications like erosions or ulcers, because don't forget that with endoscopy, it's like actually putting a camera down the throat. Okay, now another investigation you have to know is CT scan or MRI. CT scan or MRI. And you realize that the CT scan or MRI is best for type 4, and it can show colon, spleen, or other organs in the chest cavity. So that is why CT scan is good for type 4, because remember, type 4, the gap in the diaphragm is so big that it can allow contents of the abdomen to move into the chest. And then we also have the high resolution manometry. High resolution manometry is the most accurate test, and it looks for separation between the lower esophageal sphincter and the crural diaphragm. And if that space is more than 1.2 centimeters, it is diagnostic of a hiatus hernia. So high resolution manometry. What's the management? What's the management strategy? Because we need to know it, right? Now, you have to understand that management depends on both the type and the symptom severity. Management of hiatus hernia depends on both the type and the symptom severity. So let's start with type 1 hiatus hernia, which we also call sliding hernia. If the patient is asymptomatic, no treatment is needed. Okay? If the patient is asymptomatic in type 1, sliding hernia, no treatment is needed. If the patient starts developing symptoms of acid reflux, GERD symptoms, then you want to treat them medically with proton pump inhibitors and lifestyle changes as well, like weight loss. Okay? And then if there's refractory gastroesophageal reflux disease, where you've tried lifestyle modifications, you've also tried proton pump inhibitors, but none of these are helping, then you can consider surgical repair.